Hello parents, I am Dr.Deepthi, Developmental Pediatrician. I am working at Imperial Hospital, Bhimavaram. We do have a child development center with the name Happykidz, which caters to kids with ASD, ADHD, Dyslexia, global developmental delays, speech delays and other behavioral issues. Especially in this post-COVID era with a very high screen time, with outdoor exposure is very low, very small nuclear families, no real social interaction going on, speech delays are expected and they are on the rise. When there is a child with speech delay, there could be a number of causes. There could be problems with hearing. That is the foremost problem, because once the child is not hearing, he will not be able to say it out. But most parents are they can observe these small little clues that they can hear the calling bell, they can hear the ad sound and come running from other room, or they are hearing the rhymes at a very low volume also. So all these indirectly tell us that there is nothing really wrong with the hearing, but hearing loss by and large is a very important cause to be ruled out in all speech delays. The second cause would be, are they attentive to people speaking around them? So they might be hearing, but is it just going into their brain like sounds, or they are actually paying attention to what is being said? So when the attention of the child is low, obviously he won't be processing them in his brain, and once he is not processing and memorizing or storing them in his brain, there is no chance of expression, and then there will be delay. And the third factor is interest, which is the most important factor. Hearing may be normal, his attention span also may be reasonably okay, but if he doesn't have an interest in speaking to the people around him, then he will not make an effort to communicate. The same way, if the child is not interested in listening to the people around him, then he will definitely have a problem with communication. Now the next question comes, but why is he not interested? Isn't it like very normal that everybody is interested in talking to the others? May not be, because if the kid is constantly in the screens, that is so much interesting to him that he ignores all the other real world and the real people around him. See, for example, few kids are interested in vehicles. So all those activities which have a component of vehicle, like the puzzle could be a vehicle puzzle, or you could be drawing something like a vehicles and ask him to color, or you can take real vehicles and do a pretend play like road and playing with him, or you can take a car tracker and put the cars and try to talk to him. Like that, in many ways you can use his interest to get his attention. Or sometimes if whatever you are doing is not catching his attention, maybe it is not so much fun or so much what I can say pleasurable activity. So try to make it more innovative. Like for example, you are throwing a balloon at him and he is not bothered. So what you can do is, instead of asking him catch the balloon, what you can do is you blow the balloon. Just don't wind a thread around it. You can just twist it around and give it back to him. The moment he holds it, it will blow up and it will be in the air. Then you can say, shh, where is the balloon? The balloon will fall somewhere out there and he'll go running and get it back. And as the child cannot do it on his own, he will give you again and ask you to blow. So this time is a bridge for you to talk to your child. What do you want? You want me to blow? Okay, be ready. 1, 2, 3. And by the time you are blowing, he is looking intently to your face. You have an opportunity to talk to him. Maybe you can say, oh, it didn't come. Let me try again. 1, 2, 3. Sometimes they, out of their excitement, say, go, oof, udu. Udu means blow, something like that. So make the activity either interesting or choose the activity which interests them. Either way is okay. The second one is, there should be no force while you are attempting to do a speech therapy or speech facilitation. This is very important, because Most of the times when the child is not speaking till about 1.5 years, everybody is relaxed in the house. They say, no, most kids talk late in our house, or boys talk later than girls, or something like that. But by the time it is 2.5, now everybody is in a panic zone, because everybody coming to your house or wherever you're going, they ask, is he speaking, is he talking, oh, is he not talking, did you show to a doctor, something like that. So the parent comes into a pressurized mode, and now his only goal will be to get some word out of the child's mouth by hook or crook. So if you're constantly asking him, what is this, say ball, or you're showing daddy and saying, daddy, say daddy, only then he'll take you and go out, say daddy. Then the child is crying out of frustration, or maybe once in a while he may say dad, and then you're happy with it and you're like, oh, this is the right way of training. No, please, you have to understand that force will only backfire. Nobody would like to learn by force. So you might say, then without force what can we do? Without force he is anyway not speaking, so let me try force. No, that is a wrong concept. Even without force you can repeat the words which you want to hear from his mouth, but not pressurizing the child to speak. So let me give you an example again. For example, we should not go on prompting. So the third one which I am saying is, there should not be too much of prompting. Like for example, let me show you with an example. The child is pointing at something and the mother looks at it. There is a chocolate in a jar, chocolates in a jar, and she knows that he is showing the chocolate. But now her immediate goal is to make him say chocolate. So she says, I will give you only if you tell what's that. Tell me what you want. Tell me what you want. What is that? What is that you want? And the child starts to cry. So instead of that, the better way is that, oh, Ashu wants chocolate. Where is the chocolate? It is in the box. Okay, let's take the box. Oh, chocolate is inside. What to do now? I want chocolate. So let's open. Here is the chocolate. So in this whole scenario, you have said chocolate some 7 times, and in a way in which the child wants to hear, because the child is looking at you. Oh, mama understood what I want and she is trying to give me. So next time when he wants to ask something like that, maybe he might attempt something like that. So without prompting also, you can repeat the words in a way that child receives them more in a more better way, rather than pressurizing him. So this mistake is done by most of them. I think this has come from this belief that repetition will lead to better speech. We think that because he is not saying amma, daddy, mummy, we have to repeat it 100 times. No, it is not like that. He knows who is mummy, who is daddy, but right now he is not saying, because he is not ready yet by either maturation, by either his confidence, or by whatever his skills are. So the earlier speech therapy centers mostly were catering to children with syndromes, children with intellectual disabilities, children with hearing loss, and children with other problems, rather than this autism, ADHD, etc., which has become so rampant in the last decade only. So in those kids, their input itself is so low, the hearing loss kids or the intellectual disability kids. So if you are telling them 20 times, maybe they are attempting to say 1 or 2 times, and most of the kids actually have no problem also, those kind of kids, in repeating words. But what happens in autism and ADHD kids are, it is a lack of motivation to speak or lack of interest to communicate which is causing the delay, rather than inability to speak. They really don't have a problem in their oral cavity or the throat or any of the areas which are involved with speech. So this repetition will only irritate the child and frustrate the child. So this difference has to be really understood. So don't go by this false notion that the more you repeat, the more chance that child will speak. No. So, and the fourth one now, okay, you understood that you should pay attention to giving joint attention tasks. There should be no force, there should be no prompting or very high repetition. So, now what exactly to speak? This is very important. Most parents or therapists think that kids are interested in nouns, or usually nouns are the things they are told first, like you open a book and say apple, ball, cat, or you are opening or you are giving them some animals and saying cat, tiger, lion, or you are naming some colors or saying some numbers. But really, if you go into the child's brain, what the child is interested is not the nouns. Nouns is just the descriptive names of fruits or vegetables or animals, etc. But what they actually are interested in are the vehicle sounds, the animal sounds, how the animal makes sounds, or they are interested in rhymes. A lot of rhymes they are interested. They are interested in exclamations like wow, shh, go, 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 ayyo, down, up, duck, 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 go, 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 stop, something like this. So, these are the kind of things the kid actually enjoys, the vehicle sounds. You are taking an aeroplane and saying this is an aeroplane. The child is just looking at you with disinterest. If you are saying where is the aeroplane, then he might try to imitate you. Same way with the animal. He is not interested in knowing which is cat, which is dog. But if you say bo 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 bo, then he might try to imitate you. Or you are singing rhymes like Old MacDonald had a farm, and he is also trying to imitate you. And every time you are saying some animal quack 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 kind of things, he might try to imitate you. So, just give it a thought. These are the things which interest the child a lot. So, try to first initially start with these things, and also he will be very interested in the verbs, the action words. Like for example, you are playing with a car track or something. You are trying to tell him this is green car, this is red car, but he is not so interested in that. What is he interested is go, 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 stop, fast, stop. Or one car falls down, you can say uh-oh, car fell down. Or he is trying to open some jar, you can say tight, open, open please, tight, something like that. Or he is showing the door, he is trying to tell you that he wants you to open the door. So, the word that should come to you from your mouth is open the door, open, open. Or you are playing with him something like you are hitting with a stick, go, 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 stop. So, he understands what is go and what is stop. So, what is open and what is close. So, these kind of words actually interest them a lot. Or instead, you are just giving him an apple and saying, give me apple, give me orange, give me grapes, or you are asking, show me grapes, where is banana, point to banana. This is such a boring exercise for the child. Instead, if you say, if you put a hand puppet and ask him to put an apple to this, put apple, feed the puppet an apple, eat apple, drink water, brush teeth. So, you are joining a noun and a verb and asking him to do the action. So, all these three together will give him a play-like activity which he will enjoy and definitely do in a much better way. So, pretend play is the best form of teaching the child how to generalize the words. Instead of showing only flashcards or books, you can do a lot with pretend play. The simple 1, 2, 3s which you are teaching, you can actually teach with real object. 1 chocolate, 2 chocolate, give me 2, put in the box. Now 1, 2, 3, put in the box. So, something like that. If you are teaching them colors, you can put some cars and now you can say red car fast. Now green car fast. So, you use the noun along with a verb for generalization. The sixth point is that we always think of teaching them only these kind of nouns and things, but we completely forget about emotions. So how to express their thought? See, for example, a child is in this room and some loud sound comes there, or somebody is crying in the next room and he is looking at the window. So what is the thought that is running in his brain? He is thinking, who is crying? Who is crying? But he can't say that. So he is just looking at that side. So you are again pulling him back and saying, concentrate on the activity, do. But he is again seeing at that. So this is a chance when you should try to speak to him. Who is crying? Papa? Yes, Papa is crying. Small baby is crying. Let's go and see. And maybe some name. Oh, Ashu is crying. What happened? Something like that. So you have to give a voice to his emotion and thought. The same way he is playing with cars, for example, and you are naming the vehicles. Okay, car, bike, cycle, etc. And one fell down and he is actually searching for that. You are pulling him back and saying, okay, leave it, now see what is this, what is this, but he is again looking down. So this is an opportunity for you to tell him, oh, what fell down? Car. Where is it? Go search under the table. So you talk to him, maybe he'll search, he'll get the car. Oh, I got the car. So this completes his thought process. He was searching for a car, he got the car, it was under the table, and now he can play. So this point is very, very important. So you have to give a voice to his thoughts and emotions. Seventh point is that your tone has to be really pleasant, with lot of intonations, like little rhythmic, sing a song kind of voice, and don't raise your voice on the child just because he is not saying, and don't use a very flat voice. What is this? Okay. Point to the dog. Where is the cow? It's so boring. Instead you can make it more interesting. Oh, moo 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 moo, where is the cow? Bo 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 bo, I can see a dog. Or you can put his name in the rhymes, like Johnny Johnny can be made Ashu, Ashu is Papa. Or you can put, instead of sugar, eating chocolate, no Papa, something like that. Make it more playful, and you can use a lot of these finger puppets and you can play like this so that he is watching your face. You can also use lot of rings or these hollow kind of tubes to put it right in front of your mouth and talk to him. Or this hollow cardboard box kind of, not box exactly, the hollow pipe kind of things will come, where you can put one end in your ear and one end in the mouth and talk to them. Or something like phone with a wire in between, the receiver, two receivers at each end, and you can talk to him. So make it more funny and try to do it. And in the rhymes also, it is a very beautiful way to enact the rhymes. One mistake most parents nowadays I see is that, because they are told that there should not be any screen time, they think that rhymes should also not be there. No, it is not all or none. Rhymes are not the culprit. It is the way in which rhymes were given to them over and over again, like passively. Now make it into an active way. For example, 5 little monkeys is there. Every child will enjoy it. So you can take small 5 animals or 5 monkeys or whatever, 5 things, and then make them jump like this while you are talking, and you can throw one each time you are saying one fell down, and then you take your phone and say, Mama called the doctor and the doctor said no more monkeys. So the child will also be interested, he will try to do no more, or he will try the phone, or he will be just throwing the monkeys, something, but he is imitating you. Same way, if you are doing baby shark, you can take fishes and drop them in a beaker with water, and once all fell into the beaker, you can ask him, how will we remove them, let's fish them out, something. You can make this all entire thing into a very playful situation, which will engage the child in a beautiful way. So don't take rhymes as a no-no completely, use it in a very fun way. 9th one is, make it a point that your effort, whatever you are putting, will not give immediate results. So don't wait for an immediate effect. So most of the times the parents sincerely put in effort for 2 to 3 days in a row, and then on the 4th day they give up saying, I tried what all you said, but he is not speaking. So this won't come just within few days. Sometime you might be lucky enough that even within days some words start rolling, but sometimes it will take a longer time. But what is more important is his behavior would be changing. So the order in which language comes even in a normal child is also that first there will be joint attention. The child will be more receptive to whatever you are saying, whatever you are doing, whatever you are playing. He is looking at you, his eye contact will improve, his attention span will improve. Second would be his receptive language, means he is not expressing by speech or by words, but he is able to understand what you are saying. For example, when you say one fell down, immediately he is looking down, that means he understood what you were saying. Or you are just playing with the balls and then you said, oh, where is the ball? Then he is looking at the ball immediately, which means he has understood your question, although he is not expressing it. So receptive language will increase, joint attention has already increased. The third will be that his negative behaviors will come down. All those behaviors like tantrums, crying unnecessarily, doing some purposeless movements, wandering, restlessness, all this will come down slowly, because now he feels he is being understood in a better way. And then some small vocalizations will come, something like sounds or half the word, etc. And only then things of his interest will come, like whatever he needs, like do, open, go, something like that. And then the 1 or 2 word combinations will come, and only finally will he be in a position to answer when you are asking a question. So most of the parents are in a hurry or expect that while you are doing the speech therapy or whatever sessions you are doing, when we are asking him, he is not saying, he is only saying when he wants to. Yeah, but that is how a natural language comes. Even in a 1.5-year-old child, he won't be answering your questions, he will only talk what he wants to say. The same progression will be seen here also. So just you need to have some patience. Before he can answer, he needs to follow all these steps, and only when he has the vocabulary of around minimum of 500 to 1000 words will he start trying to give an answer, because only then he is confident that he can answer a question. And this mistake I see in most parents, that they start asking what is your name, etc., which is a very higher thing. Almost we expect them to tell their name in a natural sequence also when they are above 3 or 4. We really don't expect a child with a delay to immediately tell their name or daddy's name, etc. So don't expect those things. Expect what is natural for him. So this is a sequence in which it progresses, and only then you can expect them to actually share experiences, or when you ask questions like what did you see, what happened, they can share. That is only in the later part, or understanding a story, repeating a story, that is all in the later part. So initial part you have to go in the same order. Focus more on the receptive language, that means what the child is understanding, how much he is understanding from what you are saying. So by and large the rule is that by 1 year the child should understand at least a small 1-step command, like look at daddy, and he is immediately looking at daddy. Where is the fan, and he is looking at the fan. This is all his receptive language at 1 year roughly. At 2 years he should be able to understand a 2-step command, like take that apple, give to Amama. So he goes there, takes an apple and gives to Amama, means grandmother. Or get the phone, put it in the bag. So he understands 2 commands. And by 3 years usually they will know multiple sequencing of commands. They will be able to relate to the situations, and they will try to use pronouns in their language and all these things, but that is in a natural course of development. So here we are dealing with children with speech delay, so don't worry, from wherever you are you have to start from there and go in the same order. And believe me, if you do these kind of speech activities at home and do it in a very pleasant, non-pressurized way, 80% of the kids who have speech problems can be easily overcome. And by the time they go to the schools, etc., due to their interaction with the friends and others, they can develop the rest of the speech. For 20%, it may not always be so easy. For them, definitely you require a therapist help. And sometimes it might be like both together also can work. You are taking them to a therapy center for about 45 minutes a day, but don't let that alone. Don't leave entirely on that and rely entirely on that, and you are not doing anything particular at home, then the delay will take a long time to be overcome. So if you are putting all these efforts, you can see that the child talks within no time, and most of them can be very fluent within few months. And by the time they are around 4 to 5 years of age, nobody can make out the difference between this kid and the other kids. They can get the grammar, sentence, syntax, pragmatics, everything right by then, and then they can be almost just like a normal kid. So I hope this session was useful to you. Do share it to parents who are in need of speech therapy, and let's get back with some other interesting topic. If you want a one-on-one consultation for your child with speech delay or any other behavior problems, you can contact us on the number given in the description. We do parental sessions also, and parental counseling, parental speech therapy sessions also. Thank you.